Hypertension and Ibrutinib. Why do we need to monitor for hypertension in patients on Ibrutinib? Ibrutinib is an oral medication used to treat certain types of blood cancers, such as chronic lymphocytic leukemia, Kinase, mantle cell lymphoma, and Waldenstrom's macroglobulinemia. Ibrutinib works by inhibiting a specific enzyme that is important for the growth and survival of cancer cells. One of the known side effects of Ibrutinib is that it can cause an increase in blood pressure. This is because the enzyme that Ibrutinib inhibits also plays a role in regulating blood vessel tone and blood pressure. For that reason, blood pressure needs to be monitored for elevations and dose adjustments may need to be made. The need for monitoring hypertension in patients on Ibrutinib is critical due to the multifaceted ways the drug may elevate blood pressure. As mentioned, Ibrutinib inhibits Bruton's tyrosine kinase, BTK, an enzyme that plays dual roles in both the immune system and cardiovascular system. While the inhibition of BTK is beneficial for slowing down the progression of certain blood cancers, it also interferes with blood pressure regulation, which makes it a double-edged sword in patient care. One hypothesis on the mechanism behind this side effect suggests that Ibrutinib's inhibition of BTK could lead to reduced levels of nitric oxide, a vasodilator. Without sufficient nitric oxide, blood vessels may not dilate properly, causing increased resistance and consequently raising blood pressure. In the long term, uncontrolled hypertension can be a risk factor for a range of cardiovascular diseases, including heart failure, stroke, and kidney disease, among others. Moreover, Ibrutinib's effect on platelet function should not be overlooked. Altered platelet function can potentially lead to increased vasoconstriction and thrombotic events. Not only does this increase blood pressure, but it also poses an added risk for cardiovascular complications like heart attacks or stroke, especially in patients who already have underlying cardiovascular diseases or other risk factors. Adding to the complexity is that many patients with blood cancers like Kinase are often older adults who may already have elevated risks for cardiovascular diseases. They might be on other medications that also affect blood pressure, or they might have other comorbidities like diabetes or kidney disease that make blood pressure management more challenging. Due to these potential complications and the not fully understood mechanism by which Ibrutinib induces hypertension, regular monitoring of blood pressure becomes a vital part of the management plan for patients on this medication. Depending on the severity of the hypertension, dose adjustments, or even discontinuation of Ibrutinib might be required. Some patients may also need antihypertensive medications added to their treatment regimens. In summary, the interplay between Ibrutinib and blood pressure is complex and multifactorial. The drug's impact on both BTK and platelet function can lead to elevated blood pressure, posing an additional health risk for patients already grappling with serious illnesses. Thus, continuous monitoring and proactive management of blood pressure are essential for patients undergoing treatment with Ibrutinib. For more information on Ibrutinib-induced hypertension, consult reputable sources like clinical guidelines, scientific journals, healthcare providers, and government health websites for evidence-based advice and personalized treatment options.